During the genicular artery embolization procedure, a local anesthetic is injected to numb the groin region. Then, a 2 mm pinhole incision is made and a fine tube called a catheter is inserted into an artery in the thigh. Guided by an X-ray, the catheter is passed into the blood vessels around the knee joint. A special X-ray contrast liquid is injected to identify the blood vessels, which supply blood to the newly formed nerve fibers. Then, tiny particles are injected through the catheter into the blood vessels. These particles block the blood supply to the inflamed synovium. This reduces inflammation and provides significant pain relief to the patient. After the procedure, the catheter is removed. The patient can soon walk without pain and have a normal, pain-free life for at least 2 years.